The next thing we look at is how the nerve impulses get from the CNS, in this case the spinal cord, to the effector organs. You'll notice we're going to compare the effectors, which we already know. We know that the somatic nervous system controls skeletal muscle, and the autonomic nervous system controls the heart, smooth muscle organs, and glands. We're also going to compare the number of motor neurons it takes to get from the CNS to the effector. Let's look at the somatic nervous system. It's known as a one motor neuron pathway, in that it takes one motor neuron to extend from the spinal cord or CNS to the effector organ. These are the somatic motor neurons. They happen to be myelinated, so the action potentials hop along the way, saltatory conduction, and then lead to a release in acetylcholine, which stimulates the skeletal muscle contraction. You'll notice here, this pathway is the sympathetic division of the autonomic nervous system. It requires two motor neurons. One of them to get the impulses from the CNS to what's known as an autonomic ganglion. An autonomic ganglion is where these two neurons synapse, and there's a communication using acetylcholine. So this first motor neuron is known as a preganglionic neuron because it's before the autonomic ganglion. It releases acetylcholine that stimulates the postganglionic neuron, which then releases usually norepinephrine. Remember, though, there's one exception in that sweat glands are stimulated by acetylcholine. But 9 times out of 10, the sympathetic pathway is going to release ultimately norepinephrine at the effector organs. If we look down at the bottom panel, this is the parasympathetic division. It also is a two motor neuron pathway. The preganglionic neuron releases acetylcholine, just like up here, but the postganglionic neuron also releases acetylcholine. So sympathetic and parasympathetic are both two motor neuron pathways. The sympathetic division typically ends up releasing norepinephrine at the effector, whereas parasympathetic releases acetylcholine at the effector. Where these two neurons synapse, that's inside of an autonomic ganglion. Myelinated versus unmyelinated. Usually all these neurons coming out of the CNS are myelinated. So the somatic motor neuron is myelinated. All the preganglionic neurons are myelinated, but the postganglionic neurons are unmyelinated. And then finally, the neurotransmitters. One way to keep it fairly simple is if you look closely, they all use acetylcholine except one type of neuron. The sympathetic postganglionic neurons release norepinephrine. And then the exception to the rule is unless it's going to a sweat gland, then it's going to release acetylcholine. One panel that we didn't mention here is the adrenal gland. The adrenal gland is an endocrine gland that sits on top of your kidneys. It is stimulated by sympathetic neurons in order to produce large amounts of epinephrine and norepinephrine as hormones. So these will now act as hormones and be distributed in the bloodstream. So what the adrenal medulla does is it helps to boost your sympathetic responses by not just using neuron stimulation, but using hormonal stimulation. So now that heart, if you think about your heart, when you're exercising, It's stimulated by norepinephrine to increase heart rate and force. It's also being stimulated by epinephrine and norepinephrine as hormones. So that gets that heart rate up very quickly during sympathetic activity. This picture looks as if it would blow your mind, but it won't. It looks scary, but it's not so scary. So I'm going to give you a quick overview of what we're trying to go for here. Basically, you can think of this as a road map. If you think of a road map, it's a way to get from point A to point B. But there's different ways. This side is how the sympathetic division gets to the effector organs. This side on the right is how the parasympathetic division gets to usually those same organs. Notice that a lot of the organs over here on this sympathetic side are also over here. Again, the heart. If you think about that heart, you want to be able to slow it down using parasympathetic. You want to speed it up using sympathetic. If you look closely, there's a few organs that are only on the sympathetic side. Sweat glands. You stimulate them or you don't. So that's sympathetic or nothing. So sweat glands are not innervated by parasympathetic neurons. Hair follicles are only innervated by sympathetic neurons, and many of the blood vessels are only innervated by sympathetic neurons. But other than that, all these organs, there's a kidney on the sympathetic side, there's a kidney, or at least a ureter on each side. If you think about the stomach, you can stimulate it using parasympathetic. You inhibit it using sympathetic. The respiratory tract can be constricted using parasympathetic, but dilated using sympathetic. So that's how to think about this picture. Don't let it overcomplicate matters. One thing I do want to point out is where from the CNS do the neurons come out? If you look underneath the sympathetic division in parentheses, there's a word called thoracolumbar. The sympathetic division is also known as the thoracolumbar division. And that's because the neurons come out of the thoracic region and the lumbar region of the spinal cord. Whereas parasympathetic is also referred to as craniosacral. The parasympathetic division uses 4 of the cranial nerves: oculomotor, facial, glossopharyngeal, and vagus. So that's the cranial portion, but it also uses some of the sacral spinal nerves to get to these lower organs like ureter, urinary bladder, and reproductive organs. So that's one major difference between the two. You also notice that on this side it's got this weird looking thing. This is known as the sympathetic chain ganglion or sympathetic trunk ganglion. It's a big giant area that is used to allow the synapsing to occur. So it's only utilized by the sympathetic division, whereas the parasympathetic uses what's called terminal ganglia to house those synapses. So that's how you look at this. Think of it as just a roadmap, how the impulses get from the CNS to the effector organs, and there's a bit of a difference between sympathetic and parasympathetic. Here's a table. I'm not going to go through each and every component of this table, but it's a pretty thorough comparison of the sympathetic and parasympathetic divisions of the ANS. Next topic are the neurotransmitters, and now we're looking at receptors for those neurotransmitters. So what we have here is similar to before in that you're showing the 2 motor pathway. This would be a preganglionic neuron. This would be a postganglionic neuron. Where they synapse is inside of a ganglion. Here's the effector organ. This panel A is how the sympathetic division works because it's releasing norepinephrine. Panel B is pretty much the same. It's just showing a gland here, like a sweat gland. But notice this is that big difference in that sweat glands are being stimulated by acetylcholine as opposed to norepinephrine. Panel C is how the parasympathetic division works. Preganglionic neuron releasing acetylcholine, postganglionic neuron releasing acetylcholine. Now, based on neurotransmitter, we can classify. We can classify the neuron, we can classify receptors as being either adrenergic, meaning stimulated by epinephrine and norepinephrine, or we can call them cholinergic receptors if they're stimulated by acetylcholine. And many of our organs have both. Again, I like to use the heart as a very good example. If you're a heart, you've got adrenergic receptors that'll allow you to respond to sympathetic stimulation. You also have cholinergic receptors, so you can slow down when you're parasympathetically stimulated. Those receptors, both adrenergic and cholinergic, have subtypes. Adrenergic receptors come in the subtypes alpha and beta. And then you can even have alpha 1s, alpha 2s, beta 1s, beta 2s. So when you see the word alpha, or the Greek letter alpha and beta, and you're talking about a receptor, you need to think adrenergic. Those are the receptors for epinephrine and norepinephrine. Cholinergic receptors are either nicotinic or muscarinic. And that's a little bit confusing, but they found years ago that nicotine stimulates nicotinic receptors. That's why you get a lot of the responses when someone has nicotine in their body. Muscarinic comes from a molecule found in a mushroom. There's a type of mushroom that produces muscarine, and it activates muscarinic receptors. So they name these receptors based on those findings. Now, why is this important? This is extremely important when you get into pharmacology. Pharmacology is the study of how drugs work. Many drugs that we use in medicine either stimulate or block adrenergic or cholinergic receptors. For example, we've got drugs that can be categorized as alpha agonists or beta agonists. An agonist stimulates the receptor. One example is albuterol. Albuterol is a beta agonist of the respiratory tract. So you first have to know what sympathetic stimulation of the respiratory tract does. What that does is it dilates, it bronchodilates. Therefore, if you have a drug that's a beta agonist of the respiratory tract, it's a bronchodilator. So albuterol is one of the most commonly used bronchodilators. It's used to open up airways if there's constriction going on in the airway. You could also have an alpha agonist. You could have an alpha agonist of some other organ. So there's a lot of other agonists out there. There are also beta antagonists. We've got beta antagonists of the heart. We often refer to them as beta blockers because an antagonist blocks. So if you think about a beta antagonist of the heart, it'll block the epinephrine and norepinephrine. Therefore, the heart rate goes down. If you block sympathetic stimulation, the organ will do the opposite. So it'll slow down. Cholinergic receptors We've got a number of drugs that are anticholinergics. They actually block acetylcholine. We've got other beta blockers, bronchodilators that are anticholinergic. They block the acetylcholine that constricts them. So this will be useful one day, I promise. When you get into pharmacology, the autonomic nervous system is one system from A&P that's very useful when you get into that class. And we're going to mention some of these towards the end of this lecture as well. This is a table that we're going to work through in the next video. It's got a lot of information, but it's a very good table to go over and learn about ultimate responses of the sympathetic and parasympathetic division. But it's going to need its own video lecture to go over this table.